This is just a very short advice. Every couple, every family wants to have children. And this is my advice. Once you get pregnant, don't delay. Get to the hospital. Ask with your doctor when is the appropriate time to start your antenatal care. And once they tell you so and so time or so and so number of weeks is when you should come to register for your antenatal care, please don't hesitate. Register as at when due. Make sure that you attend your antenatal sections as scheduled. Let me beg the men that are listening to me. Make sure that you attend antenatal classes, antenatal clinics with your wife. What she is told, you would also listen. You would also hear what she is told at every visit as much as possible. You may not be able to attend all of the visits, but as much as it depends on you, try to make out time to attend antenatal clinics with your wife. Again, once your wife gets pregnant, woman, once you get pregnant, start to prepare for delivery. The start of pregnancy, the baby is announcing to you that in 9 months' time or in 8 months' time, I will be coming. Most women will deliver vaginally. It means that they will have what we call the natural delivery. A few women would have to undergo a CS. Another thing you should ensure is once you get pregnant, man, once your wife gets pregnant, start to gather money. If you are not financially buoyant, start to save money towards a cesarean delivery, towards a cesarean section. This is very important so that you don't get embarrassed when the doctor is saying your wife will need an emergency CS, or even during the process of antenatal care, they say she's going to need an elective CS. You won't start getting agitated, start getting irritated, start getting worried about where you are going to get money for delivery for the cesarean section. This is very important. At the end of the day, if 100% of couples, if 100% of men and women save money for, and we just have maybe about 15% or 10% or even 20% going in for CS, the money you save for your CS, you just take a little. For those who would eventually, for the rest, 80%, 75%, 85%, or even 90% that would deliver vaginally, the money that you saved for CS is for you. You can use it to take care of the baby, to take care of your wife, to use it to do some other things in the family. This is very important. What I'm trying to say is once a woman gets pregnant, she have to start, her husband would have to start, or as a couple, they will have to start to prepare for delivery. And the height of it, or the wisest thing, is to prepare for a cesarean section. But again, let me remind you, most women will deliver through the natural method. Eventually, you are happy, you prepared in quote for the worst, but the worst didn't happen. You have your money, you have your wife, you have your baby. Maternal death, maternal mortality in rural Nigeria and sub-Saharan Africa is nothing to write home about. It is very disheartening. Can you imagine 800 women dying from childbirth for every 100,000 live births? This is not supposed to be so. Let us start to bring down the number drastically. Man, woman, you should be involved. You must have your wife and your baby alive and well, and you also should be alive and well at the end of pregnancy. We need better statistics. We need to improve our maternal health outcome in Africa, in Nigeria. So this video is for you. It is essentially to have mother and child alive, not just alive, but alive and well at the end of pregnancy. Cheers to a healthy mother. Cheers to a healthy baby. Cheers to a healthy husband. See you in the next video.